Good morning, good afternoon, good evening from any part of the world where you may be joining us from. This is Dr. Lukman Olushesi from L Educate. In today's lesson, we shall be talking about convulsion or seizure. At the end of today's lesson, you should be able to describe different types of convulsion, discuss the various first aid measures to take in order to help someone who is convulsing, describe when a convulsion becomes a medical emergency, and also discuss the do's and don'ts of convulsion. Without wasting much time, join me in class.
Welcome to this episode of How Not to Do First Aid. In today's lesson, we are going to be discussing how to help people with seizure or convulsion. What are the objectives of this lesson? At the end of this lesson, you will be able to recognize the types of seizure. You will also be able to describe the appropriate first aid measures to take in order to be able to help someone who is having seizure or convulsion. You should also be able to recognize when a seizure becomes a medical emergency. And in the end, you'll be able to provide support for victims of convulsion and also to describe the do's and don'ts of convulsion. Before I continue, I want to share with you some of the opinions of people about first aid in convulsion.
Hey, good day, ladies and gentlemen. This is Olushesi from L Educate. I'm here with my fellow riders, and I have a poser. I have a question to ask them. If I go into convulsion at this moment, what first aid steps are you going to do? What are you going to do for me?
Water.
Water. What are you going to do for me?
Press your chest.
He's going to press my chest. What are you going to do for me?
Water.
He's going to pour me water. What are you going to do for me?
Water.
Water.
Chest pumping.
He's going to pump my chest. And what are you going to do, brother?
Spring water into your face.
Spring water onto my face. I have to let you know that this is definitely not how to do first aid. If somebody is convulsing, there are steps that you need to take, and that is what is coming up in our next lesson. Thank you. Lukman Olushesi from L Educate.
So what then is a seizure? A seizure is an excessive discharge of electrical activity in the brain of the affected person. Whenever there is an excessive discharge of electrical activity, it will eventually lead to an abnormal movement, abnormal sensation, abnormal behavior, and impaired awareness in the affected person. Remember, the brain controls every part of the body through a normal, organized electrical activities. When there is an excessive and disorganized electrical activity, that is when seizures occur. I did not talk about an infection. I did not talk about a contagion which could move from person to person. This abnormal activity is occurring in the brain of the affected person and cannot be transmitted from one person to the other. It cannot go outside the body of the person suffering from the seizure. So it is important for us to note this so that we will not continue to think that, oh, this person is having a convulsion, I cannot go close to him because I'm going to get infected, or I'm also going to get whatever it is that is causing this seizure. This absolutely is not correct. Now, how do we distinguish between a seizure and an epilepsy? Epilepsy is a chronic neurological disorder. I'm going to break that down. When we say chronic, we mean that chronic means a condition that is ongoing for a long time. Now, I am aware that the interpretation that a lot of people give for chronic is something that is severe, that is critical. This is not correct. In medical terms, when we say something is chronic, it means the thing has been going on for a long duration of time. It's been going on for months and years and years. All right? Now, neurological also refers to the nerves, the cells of the brain, and of course, a disorder. I mean, it is not a normal occurrence. So, an epilepsy is a disorder of the brain that is going on for a long time, and it is usually characterized by a tendency to have seizures. All right? A brain problem that is going on for a long time and which manifests as having recurrent unprovoked convulsions. When this happens, we say that the person has an epilepsy. Right? Why then do we need to learn about seizure? Why do we need to learn about epilepsy? The fact is that 1 out of 10 people may have a seizure during his or her lifetime. 10% of people would have convulsion in their lifetime. And if you consider this number, what it means is that seizures are common, and that one day you might need to help someone during a seizure, or you might need to help someone after a seizure or a convulsion has occurred. So it is important that we all know what to do to help anyone who has seizures. There are some certain facts about convulsion that we all need to know. One, that most convulsions are not medical emergencies. Most convulsions are short-lived. They last between 1 to 3 minutes, and the person usually recovers from the convulsion. Right? Then, victims may not be aware that they are having a convulsion. And even after the convulsion, they may not remember what happened. Remember, we said that the abnormal firing in the brain will impair awareness. So most of them, even after the convulsion, they will be asking, what happened? Then epilepsy is not contagious. I cannot continue to emphasize this enough. Epilepsy is not an infectious disease. Epilepsy cannot be transmitted from one person to the other. Epilepsy is not infectious. We should also know that epilepsy is not a form of mental illness, right? Epilepsy is a purely neurological problem. It's a purely problems with the nerves, the brain tissue, right? And victims of epilepsy almost never die of convulsion. And usually they don't have damage to their brain. What is common amongst victims of epilepsy is probably depression because of the embarrassment that they feel after the attack. And of course, a victim cannot swallow his or her tongue during a seizure. So please do not continue to force items into their mouth. They cannot swallow their tongue. Now, what are the causes of epilepsy? Yeah, you're right. We don't know. The cause is unknown in 70% of people with epilepsy. And in the other 30%, some of the common causes include injury to the brain, tumors in the brain, infection of the brain. It may be caused by meningitis, that is the bacterial infection of the brain. Encephalitis, measles encephalitis. Measles can be a cause of epilepsy. If an individual have birth injury or head injury as a baby, it could result into epilepsy. And of course, when the brain develops abnormally, we could have abnormal firing, which can continue to manifest as an unprovoked and recurrent seizures or convulsions. Aside from the common type of convulsion that we all know about, which is what we refer to as the grand mal epilepsy, the one that involves jerking and foaming in the mouth and all that, there is another kind of seizure that we refer to as absence seizure. This could manifest as a pause in activity. Somebody just goes blank, for a few seconds. This person may be having a seizure or a lapse in awareness. You just, you are with your friend and the person just suddenly goes lost, and you're calling the person and the person is not responding, the person is just staring. The person could be having a seizure. Sometimes this kind of seizure is accompanied by chewing and blinking motion. The person will continue to chew, making a chewing motion in the mouth, or continues to blink and not responding to whatever is happening in the environment. It is usually short-lived and it gets terminated within 1 to 10 seconds. And it may also occur many times in a day. Yeah, it may occur several times in a day. And because we are not sure what is happening, some people may think that, oh, this person is daydreaming. Some may think that this person is not always showing attention to what is happening around him or her. And the person may actually be labeled as having attention deficit disorder. For people or for children who continue to have this kind or manifest this kind of behavior, it is important to investigate further to check if this person is having a form of seizure disorder or not. What are the trigger factors for convulsion, especially in individuals who have epilepsy? Two of the most common trigger factors are flashing lights and hyperventilation. You may have observed that when some films wanted to begin showing, a notice will pop up that this particular film or content has a lot of flashes, that individuals who are epileptic it's not recommended for people who are epileptic. This is what they mean, because flashing lights of different colors can trigger a fit, can trigger convulsion in individuals who are epileptic. The other common cause is hyperventilation. When an individual who is epileptic begins to breathe in and out very deeply and very fast, it could trigger convulsion. I have seen children use this either to punish their parents or their teachers, or to just register their displeasure in whatever. They will start hyperventilating, and before you know it, they pass out and begin to convulse. All right? So we have flashing light, we have hyperventilation. other causes, other triggers that could precipitate convulsion, especially in individuals with epilepsy, include not using their drugs regularly or late medication, issues of stress when they are anxious about a particular thing, lack of sleep, excessive tiredness or fatigue, illnesses, alcohol, drug abuse, some drug interactions when the drugs they are using to control the epilepsy, and they use another kind of drug that may interact with such drug and trigger epilepsy. And of course, we could have poor or missed meals, which of course is also a source of stress. Hunger is a major source of stress, which could trigger convulsion in individuals who are epileptic. Now let's talk about generalized convulsion, the one that we usually recognize as epilepsy. Generalized tonic-clonic convulsion. It usually heralded. It starts with the sudden hoarse cry, a loud cry, all right, which is actually as a result of the sudden contraction of the diaphragm. This is usually followed by loss of consciousness and a fall. After the fall, the convulsion starts. Convulsion refers to the stiffening of the arms and legs, followed by jerky movement repeatedly. The breathing is shallow. There could be foaming from the mouth, right? There could also be loss of bowel or bladder control. These people could defecate on themselves or urinate on themselves because they are unconscious, and so many muscles are beginning to contract abnormally because of the abnormal firing from the brain. Sometimes they go pale. The nail bed is pale, the lips, may turn blue, right? It is usually short-lived, 1 to 3 minutes, and followed by confusion, headache, tiredness, soreness, sometimes speech difficulty, right? And because the jerky movement is so exhausting, many times they fall into a deep sleep and wake up later not knowing what has happened to them. So it is the responsibility of the first aider to be able to recognize that when all these are happening, this person is going through a generalized epileptic convulsion, right? Now, what does it look like to have a generalized epileptic convulsion? So we have come to the meat of this lesson. What are the first aid measures to help someone who is going through a generalized epileptic convulsion? Number 1, remember the convulsion that we're talking about is unprovoked, all right? They may have some premonitions, especially when the convulsion has been happening over and over and over again. They may have a premonition that, oh, this convulsion episode is about to start, but sometimes they do not have any signs. So they just go unconscious and begin to jerk. So the first thing you want to do to help them is to ease them to the floor. If they are if they are on the seat, in the wheelchair, or anywhere they may be, and it starts, then you want to get them to the floor. Then you must ensure that they do not harm themselves. All right? This you can do by clearing the area around the person of anything that is hard or sharp. This is very important to prevent them from injuring themselves unknowingly. Then the next thing you want to do is to get a soft cloth. Get a folded jacket, a folded shirt, a folded towel under their head, because as a result of the jerky movements, they may actually be hitting their head on the floor. So you want to cushion such movements using clothes or jackets or any other thing. If they are wearing glasses, you want to remove them. If they're wearing a tie, you want to loosen the tie, or anything around the neck that may make it hard for them to breathe and breathe properly. When convulsion stops, you want to help the victim into the recovery position. What is the recovery position? Like we have earlier mentioned in our discussion of how to help somebody who is unconscious, you want to turn them to their side in such a way that even if they vomit, they will not get choked on their vomiters. You want to turn them to their side so that the vomiting can flow out and the danger of choking is removed. So it is at this position that they usually would wake up, and you want to continue to reassure them. You want to tell them everything is okay. You want to clear the area. Don't allow them to get choked by people coming to commiserate or coming to help. Okay. So these steps are the steps to take to assist, to help someone who is undergoing convulsion episode, and also help them after the episode is over. Now, we've talked about how to help individuals who are convulsing. Now, we need to talk about how not to help someone convulsing. Firstly, you do not want to hold the person down or to stop his or her movements. Don't do that. You could cause injury to the person while trying to forcefully restrain the person, in order to stop the movement. Do not hold the person down. Secondly, do not put anything in the person's mouth. This can injure the teeth, it can injure the gum, and a person having a seizure cannot swallow his or her tongue. So allow these people to have their seizure in peace. What you are allowed to do is to ensure that you support their head with something soft, a soft cloth, such that they will not be hitting their head directly on the floor. Then next, you do not try to give any mouth-to-mouth breath. Because they are not breathing properly and they are convulsing, they are jerking. You want to begin to do mouth-to-mouth breathing. No. People usually start breathing again normally on their own after a seizure. The next, you do not offer the person water or food until he or she is fully conscious and alert. Don't force water into their mouth when they are yet to fully recover from the convulsion. They could aspirate. The water could go into the airway and cause them to start choking. We don't want to add choking to a convulsing person. Then you do not pour water on him or her. The same thing goes, you pour water on someone who is not fully conscious. He cannot control the entrance of water, in the nostril, and the person could aspirate. You could have water getting into the airway, thereby causing this person to choke. It is important that as we try to help people, we do not create problems for individuals we are trying to help. When does convulsion become a medical emergency? Firstly, for an individual without a history of convulsion and who does not also have a medical identification on him or her, who just suddenly starts convulsing, we need to take this person to the hospital for further investigations. When convulsion lasts for more than 5 minutes, I told you earlier that convulsions or epileptic seizures usually are short-lived, and they last for a maximum of 1 to 3 minutes. When you now have a convulsion that is lasting for more than 5 minutes, then it is time to see the doctor. Repeated seizures without regaining consciousness. Somebody goes unconscious and starts to convulse, and before the person wakes up, he convulses again. That is an emergency, and it should be treated as such. When there is more than usual kind of seizure, right, then it is time to approach the hospital. When the person is injured as a result of the convulsion, when the person is diabetic or is pregnant, when a pregnant woman convulses, it is a medical emergency and it has to be treated as such. When seizure occurs in water, even after the person has regained consciousness, right, it is important that this person gets evaluated in a hospital immediately. When after convulsion, normal breathing does not resume, then it is an emergency and it must be taken to the hospital. Convulsion in children and how to help children who are convulsing is generally similar to what we have discussed about how to help adults who are convulsing, right? Now, if you look at this diagram, let me highlight. Yeah, if you look at this diagram, this is the girl convulsing. This girl here is the one convulsing. All right? This fine boy is trying to reassure her. Everything is going to be fine. You will be fine, okay? You will be fine. This gentle boy here is the timekeeper. It is important that we time the duration of the seizure so that we know when to take this person to the hospital. He is timing the convulsion. So if it is more than 5 minutes, when the convulsion is over, then this little girl must be taken to the hospital. All right? Now, this fine girl here is trying to restrain this boy from holding the little girl down, because the natural reflex action is to want to help them to stop the jerky movement, but this is only going to hurt them the more. And of course you can see this guy here is trying to disallow or to keep every other hazard away from this person who is convulsing. And what this adult woman is doing is to explain to others about what they are seeing happening, because when a child convulses amongst his or her friends, then it is important to explain the situation to the other children so that they don't begin to discriminate against this person. They don't begin to look at him or her as a monster. They don't begin to look at him or her as carrying a disease, a contagious disease that they have to run away from. So, as you can see, all these children have been thoroughly educated about convulsion, and each and every one of them is playing their role to helping the victim of convulsion. What are the causes of convulsion in children? Now, it will depend on whether we're talking about newborn or children that are less than 6 months old, or children that are whose age lie between 6 months to 3 years, or children who are over 3 years of age. For a newborn baby who is convulsing, then something must be terribly wrong. For instance, it could be birth asphyxia, that immediately after birth, this newborn is not getting enough oxygen, or there is an injury to the brain. All right? There might be electrolyte imbalance, like hypocalcemia or hypercalcemia. When you don't have enough calcium in the system in a newborn, he or she could begin to convulse. When you have intrauterine infection, you have this baby coming out of a womb that is infected, then there is possibility of convulsion. Meningitis and infection of the brain, it could result from intrauterine infection too. Tetanus could cause convulsion in newborn. This is excessive bilirubin in the system. When you have jaundice, very deep jaundice in babies, it could cause them to convulse. And a baby born to an addict could actually be suffering from narcotic withdrawal and convulse. Now, for children who are between the ages of 1 month to 6 months, birth asphyxia, the trauma of birth may eventually cause convulsion amongst them. At that age, when there is a problem with cranial malformations, when there are inborn metabolism errors, what that means is that the chemicals in the body of the newborn or of the little child is not balanced, and it is causing a whole lot of problem. When we have intrauterine infection, the complication could actually begin to manifest after 4 weeks of birth. Then tumor, when you have cancer or other growth in the brain, the child could begin to convulse. Now, after the age of 6 months to 3 years, majority of the convulsion in this age group is as a result of fever. We call it febrile convulsion. When a child's temperature begins to rise, and it rises to a level, they will just begin to throw fits. They will begin to convulse. And as soon as you bring the temperature down, that is the end of it. All right? Now, for children who are more than 3 years of age and who are convulsing, it's tending towards the adult causes. Remember, for adults, in 70% of the case, we do not know what is causing the convulsion, what is causing the epilepsy. What we know is just that there is abnormal electrical firing in the brain causing so many other problems periodically. If you have infection of the brain or the spinal cord, you could have convulsion in children who are more than 3 years of age. Then metabolic problems. The chemical composition of the system is not balanced. They could also be thrown into episodes of convulsion.
Gentlemen, when we have a case of convulsion, now you must know that convulsion is not contagious. Epilepsy is not an infectious disease. the usual practice that when somebody is convulsing, like we have Junior just suffered, that, oh, don't go near him, because when you go near him, you are going to get infected with convulsion, with epilepsy. That is not true. When an individual is convulsing, the first thing that you come to your mind in helping this person is to make sure that everything that could cause harm is taken out of the environment, like the helmet, the bicycles, and every other thing that could injure this person, because he is unconscious and he does not know whether there is anything dangerous around or not. So after having cleared the area, naturally, when an individual is convulsing, after a while, they go into deep sleep, all right? Deep sleep. So during that deep sleep episode, you need to put them in recovery position. And why is this so? The way he is lying down, because he's unconscious, he can actually, the tongue can fall back and block the airway, thereby choking this guy to death. The other thing is that he could vomit, all right? And if you vomit while you are lying on your back, you can actually get choked on your own vomitors. Whatever it is that he is vomiting could go back into the throat and choke him to death. So what you are going to do to help him is to put him in recovery position to avert those two dangerous episodes, all right? Now the hand that is closer to you, you take it away, because you are going to flip this person to your side. The other hand, you put it against the air that is close to you, all right, and hold it in place. Then take the leg that is away from you, all right, fold it like that, and then flip. And the last most important thing is to tilt the head and lift the chin. This particular position would ensure that the airway is open, and if peradventure this person vomits, all the vomitors would come outside. The risk of choking is taken away from this person, all right? And having placed him in recovery position, that is the time to call for ambulance or take this person to the hospital, all right, for further treatment and full recovery, all right? And it is equally important that you want to time the period that this victim convulsed, the start to the end of the convulsion. Any convulsion that is more than 5 minutes has to be investigated further, because epileptic episodes usually last for less than 5 minutes. I hope you understand.
Yes, sir.
That is how to do first aid for an individual who is convulsed. Thank you.